All vitamins are originally produced by microorganisms or plants, not by animals. But we do have the capability to synthesize vitamin D ourselves via sun exposure, because vitamin D is actually a hormone, not a vitamin. Various claims about the miraculous effects of vitamin D can be found online. Let's make a sanity check and find out what to expect and not to expect from taking a vitamin D supplement. Vitamin D function. Vitamin D plays an important role in our body. It helps to regulate calcium and phosphate in various ways. Vitamin D can influence how much calcium is absorbed in our intestine and can mobilize calcium even from our bones, if necessary. Therefore, it is crucial for bone health. The most important dietary factors for optimal bone health include an adequate supply of calcium, vitamin D, and vitamin K. Chronic low levels of vitamin D can have various negative consequences, especially in vulnerable population groups. Overdosing can cause hypercalcemia, which poses a variety of health risks. Vitamin D deficiency. A chronic vitamin D deficiency can impair your bone metabolism. Your bones will be weakened over time, which increases the risk for bone fractures. Skeletal pain and muscle disorders can follow. Low vitamin D is even correlated with disorders of the nervous system, mood disorders, and blood clotting. A very common symptom is increased susceptibility to infections, which you really do not want at a time like this. Now, correlation does not mean causation, so many of these conditions might not improve by simply increasing vitamin D levels. Recommended daily supply. The recommended daily supply of vitamin D is shown in this table. This recommendation covers your daily needs without considering any exposure to sunlight, so without any synthesis by our own bodies. Now we know how much we need, but where do we get it from? Dietary sources of vitamin D. Significant amounts of vitamin D can be found in a small selection of animal products, such as fatty fish and liver. There are certain plant foods that provide small amounts of vitamin D as well, including avocados and various mushrooms. Neither an omnivorous dietary pattern with moderate fish consumption, nor a plant-based dietary pattern can provide an adequate vitamin D supply on a daily basis. Eating fatty fish on a daily basis is not a good idea, given the heavy metal contamination and the amount of saturated fat they contain. So we cannot expect to cover our vitamin D needs with food alone. Synthesis via sun exposure. Our body is able to synthesize vitamin D when our skin is exposed to sunlight. 5 to 30 minutes sunlight daily can be enough to synthesize sufficient vitamin D. There are several factors that influence our vitamin D synthesis. These include how much skin is exposed to the sun, skin color, so pigmentation, skin thickness, degree of latitude, so where you live, the season, duration of sun exposure, the use of sunscreen, age, degree of air pollution, skin diseases and skin burning. Given these factors, it is clear that certain population groups and people who remain indoors might be unable to synthesize sufficient vitamin D on their own. Supplementation. Depending on the degree of latitude of your hometown, your vitamin D requirements cannot be sufficiently covered during the winter months. Our bodies are able to store some vitamin D for the winter, but if you did not save up enough during the summer, your vitamin D might get depleted. If you live in the northern hemisphere, like the northern part of the United States or in Germany, exposing yourself to sunlight will likely not be sufficient given you have low vitamin D levels to begin with. If this scenario applies to you, please consult your physician about a vitamin D supplement. A supplement should cover your daily needs, likely starting from October until the end of March. Testing for vitamin D. It is always a good idea to consult your doctor before taking a supplement. You can get a blood test to assess whether you really need one or not. What you need to test for is the parameter called 25-hydroxyvitamin D3. You have enough vitamin D if your status is above 20 nanograms per milliliter. If your status is below 12 nanograms per milliliter, you are deficient in vitamin D and need to remedy your deficiency. Your doctor will prescribe an adequate supplement in this case. Between 12 and 20 nanograms per milliliter, you might benefit from a supplement, especially if you are part of a vulnerable population group. Remember that getting outside for some sunlight is beneficial, independent of your vitamin D status. What not to expect. If you search for positive effects of vitamin D supplementation online, you will find various claims like preventing heart disease, type 2 diabetes, and even corona infections. These claims are false. Vitamin D supplementation has not been shown to help with any of these conditions. It likely plays a minor role, and we should, of course, avoid a deficiency, but we cannot expect vitamin D supplementation to be some miraculous cure-all. Chronic degenerative diseases are multifactorial, with diet being one of the most important factors. Vitamin D overdose. With an exaggerated supplementation, overdosing vitamin D is possible. This could lead to an intoxication with an increased calcium absorption and an increased release of calcium from your bones, leading to hypercalcemia. Therefore, always check the label on your supplement and do not take more than the daily allowed maximum intake of 100 micrograms or 4000 international units, unless you are seriously deficient and your doctor tells you to. Thanks for watching our video. How do you handle your vitamin D requirements? Do you already have a supplement for the winter month? Let us know in the comments down below. See you next week.